Good afternoon, everyone. And we are really happy to have you here. Welcome to our Modern Slavery event, part 11. UMOJA is a multicultural organization, but we are also the Ministry of International Relations and Foreign Mission of Convent Baptist Church. And we are running this modern slavery initiative since 11 years. So I'm proud to be the president of UMOJA. And I'm also the president of a non-profit named ONG SOLI'CITES in France, so I'm French. I'm originally from Africa. I'm chairing the Human Trafficking Initiative. Happy to have you here. The main purpose of this event is to raise awareness on modern slavery, human trafficking, domestic violence among the community. I'm going to introduce our speakers. Anitha. Is it the good pronunciation? Okay, we are going to have Anitha, and she's the Senior Director Anti-Trafficking Program at Safe Horizon. And I would like you to introduce yourself. You did better than me.
Thank you so much, and I'm so happy to be here to be speaking with all of you and to learning from all of you as well. As has been noted, my name is Anitha. I'm the Senior Director of the Anti-Trafficking Program at Safe Horizon. We are based in Brooklyn, and Safe Horizon is the nation's largest victim services agency with over 60 programs all throughout the city that works directly with over 250,000 victims of different kinds of crime. The Anti-Trafficking Program is one of those programs, and we are one of the largest direct service providers for human trafficking survivors on the East Coast. So we work with mostly foreign national clients from over 80 countries. We work with all genders. We are seeing an increase in transgender, self-identified clients. We have male-identified clients, and we're starting to see more minor clients as well, especially unaccompanied minors that are coming up through the southern border who are being identified as trafficked individuals. And so we're working with them as well. We also work with domestic clients, and we work with labor and sex trafficked clients. We have a few clients who are also victims of forced marriage. We provide social services, including case management and therapy, and we provide immigration relief for trafficked victims as well. So I'm happy to be here.
So this is a great program. And if I understood well, you are not only based here in the United States, you work outside the United States?
We are based only in New York City, but we do work with clients from all over the world. So we actually right now are working with a group of clients who are still physically located in the Northern Mariana Islands to get them immigration relief to come to the United States. We get client requests from all over the world, but because of the nature of the services we provide, it's easier if the person can come meet with us in person. Of course, with the pandemic, we have learned to work remotely in more flexible ways. And so we've been able to provide case management and therapy and some amount of immigration services remotely. So over digital or video or audio services as well. But most of the clients do come in person.
Okay. Alethia Jimenez, do you say Jimenez? Okay, she's a policy specialist and at ending violence against women at UN Women. So, Alethia, could you introduce yourself, please?
Thank you so much, Angèle, and thank you for having me. So, good afternoon, everyone. My name is Alethia, and I work, as Angèle said, with the United Nations entity that works on the empowerment of women and gender equality, so UN Women. And I am the focal point within the organization that works, supports our offices as well around the world on ending trafficking against women and girls. Our work in this area is centered around different areas. One area of work includes supporting member states, meaning governments at national and local level to have policies that respond to the needs and the rights of women and girls when it comes to different areas, particularly violence, and within the area of violence, we include trafficking. We also support and work with service providers and such as Safe Horizons and other similar service providers and stakeholders around the world to make sure survivors can access services, multi-sectoral services. And we also work on different aspects of ensuring data is collected and systematically used to make sure policy recommendations come out of that so that we can act on these issues. Last and very importantly, we also work in the area of addressing issues of social norms and changing harmful masculinities. So this is in order to promote gender equality more broadly, ending violence against women, but also ending trafficking and ending impunity.
So my first question will be for Anitha. This event is about raising awareness on human trafficking and modern slavery and domestic violence. Could you please start by explaining what is human trafficking? Because there's a lot of people who don't know about it.
So human trafficking, just to use the easiest definition, I'll use the United States federal legal definition as defined in the Trafficking Victims Protection Act. It is any method or manner by which you obtain a human being, either by recruitment, or it doesn't have to be through movement, but it can be through movement, kidnapping, just the obtaining or procurement of a human being for either commercial sexual activity or for any type of forced labor through the mechanism of force or fraud or coercion. And so under US law, you only need one of those three, force or fraud or coercion, for the purposes of commercial sexual activity or any type of forced labor. And so I mentioned forced marriage before, that can come under the involuntary servitude part of forced labor. So that's usually how that's characterized under US law. Individual states around the United States have their own human trafficking laws as well. And then of course you have international norms. But in terms of the way we administer services, we evaluate the clients as to whether they're victims of trafficking using the US federal definition. And I can go a bit more into detail depending on, how much time we have.
I give more details because the more you can say, the better people will understand.
Sure. So in terms of sex trafficking, I think a lot of individuals think that's the only form of human trafficking, and they think sex trafficking equals all human trafficking. And that's not really the case. More of our clients are labor trafficked. And if we look at the global numbers, most recent numbers that were put out by the International Labor Organization back in 2016 or 2017 indicated that out of just under 25 million individuals who were sex and labor trafficked, just under 5 million were sex trafficked, which means nearly 20 million individuals were labor trafficked. And then we can add in another almost 15 million for those who are potential victims of forced marriage. And the thing to remember over all of this is that, as Alethia was saying, data is very important. And so it's very hard to get really reliable statistics because, like domestic violence and like other types of crime, it's very underreported. And so we know that for every one victim of human trafficking that we encounter and we're working with, there are many more individuals who have never been identified. And part of that is because human trafficking in the United States has only been a federal crime for the last 20 years. Slavery and forced labor in all of its forms has been in existence in humanity since the beginning of time, since the beginning of civilization. And I would argue I think that's part human nature, which is one of the things we're working on within society for societal changes. But to go back to sex trafficking for a moment, it's really the performance or provision of any type of sexual activity for anything of value. It doesn't have to be sex for money. We have worked with clients who were trafficked and they were forced to engage in commercial sexual activity for food or for shelter or for other types of things of value. So it's not always sex for money as a straight transaction. New York state law has recently changed to be in line with federal law, changed about 2 years ago. And so under federal law, if you are under the age of 18, engaging in any kinds of commercial sexual activity, you're automatically considered a victim of sex trafficking, whether there is a third-party exploitative manager or not. So as long as there is one person under the age of 18 engaging in commercial sexual activity under New York state and federal law, you're considered a child victim of human trafficking. If you are an adult, there has to be some element of force or fraud or coercion present in order for that to be legally characterized as sex trafficking. And then on the labor side, for labor trafficking, Labor trafficking is present in every single type of industry. We have a lot of clients who are labor trafficked as domestic workers, both for private families and for UN officials, for international diplomats, for government officials. And so it can become quite complicated depending on the nature of the person who's doing the trafficking, if they have diplomatic immunity. And so then you get into issues with the State Department and what can be prosecuted and investigated there. So with labor trafficking, regardless of your age, there always has to be an element of force or fraud or coercion. So there's no carve out for minors. There has to be force or fraud or coercion. And for the clients that we have served, the top 3 countries for our clients are Mexico, the Philippines, and the United States. So right now, all of our domestic clients from the United States are all sex trafficked victims. But we know that labor trafficking happens in the United States as well. And so we're doing some more outreach in those communities to identify domestic labor trafficked individuals.
So United States, they are among the 3 first countries?
For my program, yes.
Oh, okay. And how do you know about those people who are trafficked? They come to you. How do you find them? How do you work with them?
So we get referrals a few different ways. The clients we've been working with for the last few years will refer those that they know. So if we have a client who was trafficked as a domestic worker and they have colleagues or friends who are also working as domestic workers and there are indications of trafficking and abuse, they will refer their friends to our program. We also get referrals from lawyers. So for individuals that they might be working on T visas for, which is the immigration remedy for a trafficking victim, if you're eligible, they'll refer to our program for social services. So for case management, housing, and therapy, and so on. We get referrals from law enforcement, and it's very difficult working with law enforcement depending because so many of the clients during the course of their trafficking were threatened with deportation or with arrest. And so it's a complicated relationship with law enforcement. So on the one hand, law enforcement can intervene and can connect you with services, but on the other hand, they were used as a means of coercion by the trafficker during the course of the trafficking. And so it's a complicated dynamic. We also get referrals from other service providers. So if there's a service provider that's a shelter and they provide housing, they'll refer to us for other services. And we do get referrals from the Polaris hotline, which is the National Human Trafficking Hotline. Okay. And we've also gotten referrals from people just walking in.
Okay.
So it's a variety of ways.
Okay. My question for Alethia, are you here? Alethia, I have the same question for you. So you are a policy specialist on ending violence against women. You are going to share with us your reports. You have a wonderful report to share, I know. I was wondering, how do you find people you are working with? They come to you or about ending violence? Human trafficking and domestic violence are the 2 crimes who are not reported. So how do you find people you work with?
Well, as a United Nations agency, we don't provide services directly to survivors like Safe Horizons. We partner with organizations like Safe Horizons and others in different countries to make sure that survivors can access the services. We work a lot as the United Nations as being an intergovernmental organization with governments to make sure they're investing in the issues of violence, that they are also supporting grassroots and local organizations to make sure that they are also funded to provide the services, and to make sure there's also availability of state services and state-funded services for the survivors. We also provide, protocols for standards. What are the essential services that victims of violence and other forms of and trafficking included? What do those standards look like? Access to justice, access to health, access to psychosocial support and recovery, after they have received some of these services. I don't know if you want me to go through my quick report now or wait for your next question.
I would like you to wait for your report. The subject is about how we can help minorities of human trafficking, women, children, during the time of COVID-19. So Anitha, you say that you like to talk about how those problems are growing during the time of COVID. I have a lot of questions, and after that, you will share your report.
Okay.
Alethia.
So what we're seeing during the time of COVID, and the clients we were already working with in February and March, they continue to have really high needs regarding food and housing and immigration relief. What we were seeing, though, was that clients who previously had been stable, so clients who we helped get their green cards and they had family reunification and they were working, they lost their jobs, which meant they were unable to pay rent, and many of them are in rent arrears, and they experienced food insecurity. And for many of our clients, they became sick with the virus. And so we have clients who everyone in their household became sick. For clients who were living with other migrant workers, we saw that landlords did not want to have so many individuals living together because it would potentially increase the possibility of infection. And so they were evicting people, which was prohibited in New York State, New York City. So we have the current clients we continue to support, and we have this boomerang effect of other clients that are coming back. And the problem is, for clients who previously were trafficked, once you're food and or housing insecure and you've lost your job, you're so much more vulnerable to re-trafficking. You need to make money. And even if you have status, we've seen sort of similar to how we've seen with the price gouging, hand sanitizer, and antibacterial wipes, the prices have gone through the roof, and there have had to be sort of threshold and mechanisms put into place so the prices can't go above a certain percentage. We are seeing the same type of exploitation, and so in the worker field. So for clients who are domestic workers, it's been one extreme to the other. Either the clients were laid off and they weren't given severance pay and they were told to leave immediately, and so they have no stream of income to support themselves and potentially their families. And then on the other side of the spectrum, we have clients who, because they had nowhere else to go, they were live-ins, the families are having the live-in workers do everything. So they are making the workers go to the grocery stores and do all of the shopping and take care of all of the household items and all of the activities, and there really is no break. And so because you're living in this home with your employer during the pandemic, all of the mechanisms that already are potentially in place for exploitation and abuse are heightened, because now you're going to be given additional responsibilities that the rest of the family cannot take on because they don't want to get sick. And we're also seeing, same as folks have been saying with domestic violence, there's an increase in domestic violence because people are together in the home now. It's same thing with abuse against domestic workers and folks who are workers who are living in the home with their employers. You have all members of the household who are home now. So that increases the possibility of physical and sexual abuse. It increases the possibility of decreasing work breaks and increasing work time. And so we're seeing clients who don't have access to food and they're made to work 18, 20 hours a day. So we're seeing this sort of across the board. Our concern also was looking at construction workers. We know that essential construction continued in some aspects. And so we want to make sure that as New York City starts to reopen and construction continues and expands, that construction workers are not going to be exploited and taken advantage of. And so we're looking at all different industries across the board. With restaurant workers, when the restaurant shut down, there wasn't a need for all of the workers you would typically have in a restaurant. And so many of our clients were laid off. And when you're laid off, it's your financial vulnerability that exacerbates your risk for trafficking. As restaurants reopen, what does this look like? Does it mean now you go into overdrive and you're working a much heightened number of hours a day because you're trying to make up for that lost revenue? So we're seeing all of these different dynamics depending on the stage we're at with the pandemic.
Okay, so now Alethia, could you share with us your report?
Absolutely. Thank you so much, Angèle. Can you see my screen?
Yes, I see your screen. Very well.
Perfect. Okay, so I think Anitha covered it very well. She spoke about some of the statistics about human trafficking. I wanted to focus a little bit on the first on the gender dimensions of human trafficking, because while we do see a lot of men and boys also being trafficked, the data that we have from the United Nations Office for Drug and Crime shows that the number of identified victims of trafficking and I know I'm talking about identified victims because there are no estimates of prevalence. Really, we have the numbers of who we identify as victims, and there, of course, there's the ILO has come up with a methodology for estimating people under different forms of forced labor and trafficking. But the majority of victims identified are women and girls. You can see the numbers on the screen. Girls particularly have become a worrying trend because we're still starting to see that more young girls are starting to appear also globally. I'm talking about global statistics as identified victims of child trafficking. 75% of child trafficking victims are girls. The majority of these women and girls, 96%, are victims of trafficking for sexual exploitation, although it's not the only form, as Anitha was saying. And then, you know, another thing that that we have like evidence for is that, you know, women and girls are more likely to be trafficked by an intimate partner or a family member. So this also kind of starts bringing the issues of the links between, you know, issues of domestic violence and gender discrimination in the home as a whole, that makes women and girls more vulnerable. So another thing to frame the discussion is that why do we talk about trafficking as a form of gender-based violence? We know gender-based violence is a form of violence that is directed at an individual from their biological sex, gender identity, and it is really rooted in the issues of gender inequality and patriarchal structures that we have in our society. So, you know, looking back at the numbers and how UN Women, you know, also views this issue is that because trafficking is a gendered crime, it is also it's very much linked to persistent gender inequality. So when we're talking about prevention, it's really important to understand that to work on prevention, we really need to start talking about what are the root causes. And one of the main root causes for this to continue to happen is unequal status of women and girls globally, or other vulnerable groups. As it was mentioned before, the LGBTI, we're starting to see a lot of members of the LGBTI community as well being in vulnerable and exploitative situations. The issue of demand for sexual exploitation remains an issue that it's sometimes not as visible as it should be. It's the demand that really fuels the exploitation of women and girls, and it's mainly men who purchase women and girls in the sex industry. So while we're looking at what needs to be done, we need to talk about the issues of gender norms, unequal power relations, and harmful masculinities that create this environment globally for trafficking to continue to happen. Now, just real quick, what has happened during COVID-19 is really worried. We've been speaking about the shadow pandemic, but essentially violence against women and girls has existed before COVID-19. And we have seen a number of like alarming statistics around the world because of the lockdowns, because people are like staying at home, sometimes with the perpetrators of violence themselves. We have seen a tremendous increase between 30% to up to 500% in some countries in Africa as well, and in Latin America, of increases of calls for domestic violence help. So domestic violence has intensified, and I'm going to talk about how has trafficking also been affected by the pandemic. But you can see here some of the quick snapshots of how COVID-19 has impacted the issues of violence against women. Now, in early May, we partnered with the Office of Democratic Institutions and Human Rights, which is part of the Organization for Security Cooperation in Europe. And this covers 56 countries around the world. And we launched a global survey beyond the 56 countries. We launched a global survey to ask survivors of trafficking and stakeholders, what are the impacts of COVID-19? We received responses from 385 organizations across 104 countries and 94 survivors from 40 different countries. And of course, when collecting data, we always ensure that safety and ethical standards are ensured. So I was mentioning, you know, there's always the need when you're looking at data and collecting data to make sure that survivors, if they need access to support, that there's a link or information provided to them to make sure that they can access services. So all of these ethical standards were provided. So I wanted to quickly show you some of the results that have come up from this assessment, and we will have it published hopefully by the end of July, but some kind of preliminary reports. The impacts of COVID-19 on trafficking in women and girls have been noticeable. We have heard from survivors and the stakeholders that answered our survey that there has been an increase in vulnerabilities, of course, because of the increase in inequalities, increase in poverty. People have lost their jobs and incomes. And we know that poverty is gendered. We know poverty is feminized, meaning women and girls are more likely to be poor, are more likely to work in the informal sector, and have less access to equal opportunities for employment. So this COVID-19 economic crisis is really exacerbating these inequalities and poverty around the world for women and girls. The COVID-19 situation has also pushed traffickers and abusers to have alternative forms of exploitation. There has been also a rise in increases of like grooming online and harassment and violence online to try to, as a result of also a spike in the use of online technology. There have been a lot of barriers in some countries. In some countries, it hasn't been as impacted. In some, it has, for survivors of trafficking to access goods and support services, particularly around the delays of judiciary responses, because governments around the world have shifted the response, both health sector, justice sector, etc., to enforce lockdowns to keep people healthy from the pandemic. People's women's and girls' access to justice has been, severely impacted. And of course, we're like seeing shifting priorities away from trafficking responses. So I've included here a few quotes of how some of the female trafficker survivors that answered the survey have responded. There's been an increased level of anxiety, in some cases because of the impacts, the psychosocial impacts that trafficking causes in many of the survivors. There's also, we have seen we asked both male and female survivors, how do they feel about their financial well-being before the crisis? Is it significantly worse, or this somewhat worse, or no change, since the crisis started? And we do see very significant differences between how women have been impacted. For example, if you look at the graph, when we're talking about the issues of financial well-being and the issues of access to income and resources, it has been significantly worse for women, according to the respondents that we have. The issues of psychological state, I think, have also been significantly worse for the women that answered the survey. I have to say that the survey was largely also answered by women. So some of these answers may not be statistically representative of every country, but this is some information that's coming through, and I think we need to pay a lot of attention to that. Access to goods and services, and you have the goods and services here, food and water, and comfortable accommodation, employment, legal assistance, psychosocial services, and information. We do see some gendered differences in how some, women have found it in almost all cases to more difficult to continue accessing these services, except for legal assistance, which was equal for male and female. But again, something to pay attention to is that, we are seeing a significant impact of COVID-19 and, the issues of trafficking. As I was saying, we also asked whether survivors have been exposed to different types of offers during the pandemic, either online or offline, or knew of people who had been, targeted for recruitment and into exploitative means. And we do see gender differences in, the different types of offers that women and men are receiving. We also included in our survey, I forgot to say this, other groups that are, that are gender non-binary, to see if they chose to identify like that. But we didn't receive any responses from gender non-binary people. But again, you can see, we need to start paying attention to some of these results, and that's the purpose of this survey. We're going to be issuing some recommendations for governments globally and for stakeholders to see how we can deal with this pandemic. And this is the last one. There's an agreement between men and women who answered the survey and stakeholders that women and girls seem to be a bit more affected than men and boys at this current moment. I'm going to end there. Thank you so much.
Okay, thank you, Alethia. So to remind you that Alethia is a police specialist at UN Women, and she did us the great honor to join us today. So this is a question for Anitha and or you both. Why is it so difficult to fight against human trafficking and domestic violence? Why is it so difficult?
I think I'll stick to trafficking. I think it's so hard to identify. I think there's a lack of awareness. Many times we do trainings in the community and even with medical providers, with lawyers, with educators and with youth. People don't really know that labor trafficking is happening. And so awareness is a problem, identification is a problem, because on the face of it, it is not illegal to work in a restaurant. It's not illegal to work as a domestic worker. It's not illegal to work in construction or in a hotel or at a country club. And our clients have been trafficked in all of these places. For domestic workers, you're inside someone's home. You might be locked in. Your documents are confiscated. There's a lot of coercive tactics that are used, in addition to fraud and force, that keep you in your situation. And it's very hard for folks to self-disclose that they're a victim of trafficking or to be externally identified because of all of these factors working against you. So it's a combination of things. And I think on the law enforcement side, we see a lot more attention paid to sex trafficking than to labor trafficking. And the TIP report came out yesterday, and so one of the pieces of information, one of the comments in there with respect to the U.S. section was there's been, I think for at least the second year in a row, there's a decrease in prosecutions. We need to have more focus on labor trafficking because so many more people are being labor trafficked, but we also need to have victim-centered and trauma-informed protocols to work with individuals who are being sex trafficked as well. So there's a number of reasons.
Yeah, and Alethia?
I think from
yes, go ahead. Go ahead.
Same question. I think from my side, to complement what's already been said, I mean, it's also a crime because impunity is so high and there's so few prosecutions. Like it's an easy crime to commit, unlike others, and so there's almost no consequences to it that you see. Like when you start looking at legislation in some countries, other crimes, petty crimes are more punishable than the crime of selling people. And I think that's one of the biggest challenges, and as well as the issue of sometimes both violence against women and different manifestations of it and trafficking, they're entrenched in people's understanding of our gender roles and what is acceptable or not, and why is it acceptable for some people to be exploited in the fields or in the restaurant industry or in the sex industry, to it's acceptable for some groups of people, right? Because they're poor, because they're migrants, because they're illegal, etc. So it's about the way we think about the value of people, and particularly what we think around the value of men and women and other vulnerable groups like LGBTI communities, right? There is so much gender and discrimination and xenophobia and many other aspects that make very particular groups of people vulnerable to these issues. So it is that's why I was highlighting the issue of social norms and harmful masculinities, and why it is important for us to stop and think, this is why it's hard, because sometimes we don't realize that it's a human rights violation and against certain groups of people.
I'm originally from Africa, and there is something like forced marriage. People don't even know that it's not good. They say, okay, I'm going to get married. I'm young, but some women, maybe they are beaten. They are not even going to talk about it. So this is also why we are doing this event about raising awareness. I was a victim of labor trafficking, but I didn't know it. I didn't know that it was before Moya. I didn't know. So I was thinking about what this person is mean. She just took my passport and she's just mean. But no, this is, and I was saying, oh no, it was a small case. But there's no small cases. It's a case of, and people don't know, some people don't really know that they are in human trafficking or in domestic violence. So what can we really do? What is the best way to help those people? What can we do? We are, for example, UMOJA, we work with a lot of other organizations around the world. My nonprofit ONG SOLI'CITES is a French organization. So how we as organization, what can we do to help those people? Specifically in time of COVID, what can we do?
I mean, I think the number one thing that our clients are asking for is assistance with their basic needs. So for clients who are living in food deserts or there wasn't a lot of food delivery, we were giving out electronic gift cards for clients to get food, but they couldn't get delivery because the stores were closed or they didn't want to use the public transportation because their children were immunocompromised. So if you can donate to your local food pantries, our clients are going to the food pantries and that is where they're getting their food if we're not able to directly provide food. You know, for clients who are housing insecure, we're trying to pay rent, but know that, you know, we just need to raise the awareness of what worker rights issues are. If people don't know something is happening, people are not going to do anything about it. And so we need to raise the awareness of the possibility of exploitation and trafficking in all of these different work industries. And so when you go to a restaurant, when you are tipping your worker, hopefully that tip is going directly to the worker. You know, all of these different things that we can take into account in terms of are we paying a fair and livable wage to all of these workers in these different industries? Are people being treated appropriately? For agricultural workers and for other workers in the time of COVID, we were advocating for reforms for social distancing, that workers in the fields would have access to hand washing stations, that their bunks weren't placed on top of each other, that they weren't all being bused to the fields, 20 people crammed in a bus where there's no social distancing.
Yeah.
For the public, it's donate to local community centers or food banks, provide actual food. We have clients who could really benefit from blankets, from socks, from t-shirts, from canned goods, granola bars, things that are non-perishable that they can take with them from shelter to shelter. We've had clients ask for safety combination locks so their things don't get stolen in shelter. Tampons and sanitary napkins are a big thing for our clients, and those are expensive. Diapers is another big thing for a lot of clients who have young children. We've got clients who have children with special needs in terms of gastrointestinal issues. And so getting the children access to cans of Ensure if they can't chew regular food. And so all of these different ways that we can support people in their most basic needs is very important. And these are things the community can do.
I also think that at the community level, there's a lot of things that we can do. I remember a lot so well how well the campaign of if you see something, say something has stuck in New York City. And I think it's important to also look into that when we're experiencing or seeing, you know, something doesn't add up. You know, there's screaming next door to me. My neighbors seem to be having a quarantine, etc. There are tips for, you know, positive bystander interventions on how to do this. So I would encourage you all to follow UN Women's website or Instagram. We have published tips on how to address issues, you know, of domestic violence or any other form of violence during COVID and during the lockdown. There is an also updated link to helplines, both for violence, and the helplines for trafficking will be soon added as well. So you know, I think it's also not to turn a blind eye to some of these things. And not to think that they are personal matters. And you know, there's ways in which we can act and be, you know, create positive change within the community. And more importantly, also kind of let's question our attitudes about what we think are the roles of and responsibilities of men and women and different men and women and other groups, migrant workers, etc. And also I think, you know, inform ourselves about rights. There's workers' rights, you know, and every state has has a very good setup on that. So what are those workers' rights that we can also help the communities that serve us in the restaurant, the domestic
Yes.
workers, etc., for them to be informed about their rights?
You are totally right. And I had a really great news from ILO. They just ratified the ILO Violence and Harassment Convention. I don't know if you hear about it. This is really great because the convention is adopted by International Harassment Violence Convention, and it's the first one of this kind who will fight against harassment at work. So this is really, really a great law. We know that we need to raise awareness. I spoke with a few women, group of women in Africa on rural areas. So most of them are working in the informal sector. And what is happening with the COVID-19 is that they cannot go outside to sell products. So it's really, really, really hard. So we are trying to bring together organization to help those women in rural areas. So this is a question for Alethia. How do you work with other organizations outside the United States?
I think the example that you gave, Angela, is really great because with the International Labor Organization, we have been working on, developing a guidance note for employers on, what does this convention mean to you, right? Like our government signed up to all of these big commitments, and you as a business owner, what can you do? And this convention is really important because it's the first time an international instrument of this type recognizes that violence doesn't only happen in the world of the domestic sphere, in the private sphere. I mean, we do have recognition, like after a few years of discussions and movements around the world, that violence also and harassment in the streets, it's also a big issue. And now with this convention, we're starting to recognize that harassment, and I think, and this was also pushed forward a lot by the Me Too movement, is like, when in your workspace, what does that mean, to be violated in so many different ways through harassment or other forms of violence. And, for example, we've collaborated with ILO to develop a handbook for private sector and public sector, but employers in general. What do you need to have? You need to have policies. How do those policies look like? What are some of the examples of good policies? What do you do if your employer is experiencing violence? And I would be happy to share with you the link. We recently did a webinar with besides from this guidebook, with around 500 global companies and partners of UN Women that are part of our signatory to the Women's Economic Empowerment Principles, like big companies like L'Oreal, like
I know. I had
many other companies, and we were providing specific guidance. What can you do as companies during the lockdowns? How can you keep a check on your employers to make sure they also have access to protection, even though they're working from home? So these are some of the ways in which we collaborate with other organizations, and we put resources out there that are for the public good, to see, as guidance, to see what else can we do better as individuals and as organizations.
So yes, so if you can share the link with us, it would be great. It'd be really great. And you spoke about something about L'Oreal. I know that they launched a program in France to help people working for COVID-19. Anitha, you say that we have to be aware of how people are working, where, and what is happening with the social distance. We know what you need, but what can we do now to improve this kind of situation, except raising awareness and helping, giving something to help? What do you need? What, for example, your organization need to move forward? How can we help you?
Well, what we've done is we've appealed to a lot of our private funders. We have 2 larger private funders, and asked them for additional client assistance that we can use to directly pay clients' rent. The Anti-Trafficking program at Safe Horizon has an Amazon wish list. And so if you go on the Anti-Trafficking program's website, and there's a different one. So Safe Horizon at large has their own Amazon Smile list. The Anti-Trafficking program has their own program specific one. And so we have items there that people can buy and donate. And we give them directly to clients. So it
Okay.
includes food and water and sanitary napkins and t-shirts and undergarments and deodorant, soap, things like that. So we're finding that for clients that are in and out of shelter, they find those things really helpful. And then honestly, it's just great having conversations.
Yeah.
So minors are labor trafficked too.
Yes.
So we have worked with labor trafficked minors who have these conversations that working this many hours without any rest breaks, and under hazardous conditions and no protective equipment, that is not okay. That is a violation of state and federal law. And so once you start to have these conversations and these incidences are coming to light, say, oh, here's a provider I can go to. Here's a phone number I can call. I can have a consultation with somebody and I can see if I'm eligible for services or some type of support. So it really starts as simply as having a conversation. I remember we did a training for another community-based organization, and they work with Nepalese women. And so one of our survivors and our trainer went and did the training on a Saturday to that staff and those groups of clients. And then one of the women disclosed after that not only was she a victim of domestic violence, but she thinks she was also being labor trafficked by her then husband as well. And so she was connected to our program and able to access a different range of services specific for human trafficking victims. And so we need more cross-identification between domestic violence and human trafficking. So many of our clients are victims of multiple types of abuse. They suffered child abuse when they were younger, sexual assaults, domestic violence, intimate partner violence, and other types of abuse and victimization. And we also need to educate our faith-based providers. So this is a very appropriate forum for that. You know, we know a number of our clients, the only place they were allowed to go when leaving the home, if they were domestic workers, was to church. And so they disclosed to fellow congregants that this is what's happening to me in the home that I'm living and working in. Is this normal, or this doesn't feel right? You know, when the person would say that's abuse. That's literally what one of the congregants of one of our of a church that one of our clients went to said to her. She said, your documents should not have been confiscated. You should be given more food to eat. You should not be made to work 18 hours a day with no breaks. That is abuse, and let me try to help you. So we need to educate more faith-based individuals and entities, and also medical providers. We know that the majority of human trafficking victims at some point during their trafficking will access medical care at some point. And so what are those entry points in terms of smaller community-based clinics or urgent care centers, larger hospitals, emergency rooms? You know, to bring it back to something that's COVID specific, I was talking with a Queens-based hospital with their pastoral care person who oversees the pastoral and spiritual care program. And she said that at the height of the pandemic, so around March, moving into April and early May, the labor and delivery nurses and assistants were saying that women coming in to give birth were disclosing that they were victims of human trafficking. And they were disclosing to their medical providers during the pandemic. And so what are the resources in place for the medical providers to ask the right questions and then to offer services or referrals to the extent that the patients want to engage in that? So just trying to cover as many bases as possible, educating folks and providing referral sources.
Okay, so if we can, you can provide us with the link.
Sure.
So that, yes, this is what we do, awareness, and awareness is also prevention. So this is what we can do. I know that there are private lines. If people are victims, they can. I spoke with someone who said, I know that in my neighborhood there's a case of domestic violence, but I don't want to talk about it. And yes, because they will know that it's me and I may have some problems. But I know that there is private lines. Is it right?
Yeah, so Safe Horizon for New York City operates the city's 3 24-hour hotlines. One is for domestic violence, one is for sexual assault, and one is for other types of crime. And so you can call those hotlines any day, you know, any time of the day, any day of the week, and you can report anything. And in terms of anti-trafficking reports, the anti-trafficking program has its own intake line. And so folks can call that line and either report potential trafficking, we will need to ultimately speak with the person who might be trafficked, or to at least know that that person is consenting to engage with us. The consent is very important.
Yes, yes.
And so I can provide you the links and the phone numbers.
Yes, please do. So now I have a question for Alethia, for you. Why is those disparities in gender equality? Why? Because I saw that women doing the same work like men don't have equal pay. Why is this? You are the policy specialist. You can explain this to us.
We ask ourselves the same thing every day at work. I mean, listen, there's a lot of research and analysis that has been done on this area, but essentially it comes down to belief systems and opportunities, right? So where does gender discrimination start? It starts in the family, on equal roles. The women clean, the women cook, the women stay at home, like, so we need to also start. So if you look at it, from a starting, within our own spheres into the globe, we always talk about, let's start with our individual relationships. How do we relate between each other as women and men, and what do we understand our roles are, and are there shared roles and responsibilities within the home? Then of course, and the family, right, the wider family, and what are the opportunities that girls get? Do girls get the same opportunity? In many of our countries, I am from Mexico, and and I've lived in many places, and I've seen it in Africa, as you were saying. Girls don't get the same priority as boys to go to school. There's more value to educate boys as compared to girls, because
this is true.
Boys have another expected role from society as compared to girls. So it all starts from, where do we see our girls and boys going, and how do we see ourselves in that role, within the home? Fathers, husbands, do they help with the chores in the house and stuff? So I think that is that's one of the main issues that kind of generates gender inequality rate, right? And then of course, then you go to the workplace, and you have more value for the same job that a woman does and a man does. But where does that belief system start? It starts in the home. And in fact, the most successful programs in the world on any thematic area, that, but be it economic empowerment or violence against women or political participation, they really start about changing those basic belief systems about social norms. I mean, it's also a very relevant issue in the US right now. Do people believe that women can lead a country? Do people believe that women can, be in power
they can.
And doing legislation, etc.? Of course they can, but not everybody sees it like that, and that is part of the problem, that we don't see that role in society as being equal. And this is a problem, both men and women bring. Some women also don't believe that. So it's not just about men believing that women are equal. It's about women also believing that we can do the same jobs, we can play the same political role as men, and also that educating girls is equally important as educating boys. And also violence and harassment are, play also a big role. The fact that a woman wears a short skirt doesn't mean that she's asking to be harassed, right? So all of these things, like, they're part of, like, we don't even see them sometimes, but this is why gender inequality exists in the world. And there's not one single country globally, even the ones that have the highest gender equality indexes, where maybe parity on salaries is almost reached, where you have women presidents and prime ministers. Like, even those countries have not achieved full gender equality. So we really have a long way to go, as globally.
Okay, I totally agree with you. I totally agree. And this is why I think that I hear about the he for she. And this is why it's very, very important to have men involved in this kind of subjects. And they are coming more and more. And I saw also that there's more and more men involved in domestic violence. There's men, there's not only a matter of women, there's also men. Anitha, do you have some case involving men in human trafficking or domestic violence, or?
We do, yes. So we, our client population used to be 30% male identified, and it's increased a little bit to just over 20%, but we are seeing an increase in transgender clients that are male to female transitioned. And so we've seen male victims of sex trafficking. We've seen male victims of sex and labor trafficking. Many of our labor trafficked victims are female identified. Most of our sex trafficked victims, in keeping with the UN Women Report, are female identified. But we're seeing more male identified victims coming forward reporting sexual abuse, sexual assault, and sex trafficking. And what's so interesting is that one of our male survivors who was labor trafficked, he and I were having a conversation maybe a year and a half ago, and he had said that he referred 2 male friends to our program, and they were labor trafficked, but they had suffered one of them suffered sex trafficking, and one had suffered some sexual abuse and assault in the course of the trafficking. And because at that time we did not have male identified staff, those 2 potential clients didn't feel comfortable disclosing to our female identified staff about the sexual abuses they had experienced. And so I thought about that for a long time. And so now we have 1 male identified attorney, and we have 1 male identified social worker, and the remainder of the staff are female identified. But now, I mean, it's the choice of 2 genders, which is still not fully inclusive, but now at least if a client comes to the program, we can say, do you have a preference for who you want to work with? And so we've noticed that a lot of our male identified clients who've suffered sexual assault, they want to work with our male social worker. And so we can offer that when we couldn't before. And it skews the data when you don't have resources to offer individuals such that they feel comfortable disclosing. It skews the realities of what people have actually experienced because they're not disclosing. When they disclose, the data becomes more reliable. And so, we're getting there, but it's definitely a problem.
Okay, so we are arriving at the end. Alethia or Anitha, do you have something to add? Do you have something to ask? Do you want to have something to share, a link, everything, how people can reach you? What kind of people do you want to work with? And do you have something to share before the end?
But is it easier if I email you the link and the phone numbers, and if you want to put it up on your Facebook website?
Yes, please. Every link, every report link, everything you want. This is what we do, awareness. So everything you can share is welcome.
I'm happy to do that. Just thank you for hosting this event and focusing on the pandemic as well, and these heightened exacerbations of abuse and exploitation. I think people need to know about it.
And the link of the event will be shared. Laura, I have here a member of Convent. Laura, who is there. Do you want to ask a question?
Hi, thank you so much for coming, and to help us to understand more about what we are in terms of, human trafficking right now. And so something that I want to ask is, when you say organization, okay, UMOJA is a ministry. We are part of, a ministry in Convent Avenue Baptist Church. So we are we work in panel with Lott Carey. That is that is an organization that Christian organization that start to help with the human trafficking and go to it's working for years trying to make people know what this means. That is not only about to have, sex with someone that is an immigrant and all the stuff. So we were coming so far to understand that human trafficking and, domestic violence and discrimination by your gender or your needs is something deep. So as we have some resources, I would like to ask you, because you were talking about food pantry. So in Convent also we have it's a food pantry that we have on Mondays. I think it's the first Monday, I don't know right now, but that maybe your clients or people that they can also participate. We have them in church to offer to them. And also we are a safe house. Our church is one of the churches in Harlem that it considers a safe house. That they know that they come to our church or they come asking for help. We have resources to connect them with another organization. The thing that I would like to ask is, okay, you were saying that to help we can, provide money to some organizations, so you can help people with transportation, or whatever that are needing. So I would like that maybe, that it is an organization that maybe, because I'm part also for the young adult ministry, and I know that they have sometimes like a mission during the year, and people sometimes, they donate money. So we were helping, the COVID-19 to some nursing homes, and to feed maybe the first responders. So maybe I can bring to them some of the organizations. Maybe we can help with, I don't know, with sanitary pad or tampons or diapers, or okay, things that you say very clearly that maybe it will be easy, to contribute. So we can do something like is specific, and now the awareness is very important, is the most important. But at the same time, maybe we can do small things that, it can help them in some way.
Laura, you are right, because this is what we are talking about here. We say, how can we help the victim minority? So it's not only about awareness. So they say that they will share all the links and the reports, and we can always come back to you with our ideas, and you can say, okay, this is good, this is not good, and this is how you can do this, or
because
Laura, yes, Laura, let's talk about it after. We will see what we can do after, because we do the briefing and everything. So they are going to send us the link, and we are going to come back to you both to see how we can work together and what we can do. So this is quite the end. So I was really happy to have you. Do you want to add something, Alethia or Anitha?
No, thank you for having us, and I will also make sure to share my links with you, Angela, so you can disseminate through your networks.
Yes. And I also understood that the community in faith can have a great role in this fight. So we are UMOJA, the Ministry of International Visitation and Foreign Mission, and we work with Lott Carey, and this event is supported by Convent Baptist Church. So I say thank you to Convent and to all the people who came to watch, to participate to this. And thank you so much, Alethia. Thank you very much, Anitha. And I'm sure that we will have another event, because I still have a lot of questions. Okay, so thank you very much. Thank you everybody for being here, and let's stay in touch. Okay, I will come back to you. Okay, bye-bye.
Bye.
Bye.
Bye, thank you.
Thank you, Chicken Terry. Thank you very much.
Great job.
I saw you. Let's talk after. Okay, bye.